Hi, welcome to my clinic. My name is Dr. Amy. It's nice to meet you. So how can I help you today? You'd like to get some lip filler? Of course I can help you with that. So have you had lip filler before, or is this your first time? It's your first time. Okay. Perfect. And what kind of look are you going for? Do you want something more natural, or something that's different to how your lips are, like drastically different? You're looking for a natural look. Of course. So for a natural look, I will be recommending half a ml of filler. This will just give you like a little bit extra plump, but it is still going to look like your natural lips. People really won't be able to tell the difference, at least once the swelling has gone down. Are you happy with that? You are? Okay, perfect. And do you mind if I have a quick look? Okay. Could you smile for me, please? Okay. You have beautiful lips. Very beautiful lips. Did you want to put an equal amount in the top and bottom lip? Or did you want to do a bit more on the top, a bit more on the bottom? Do you have a preference? Oh, a little bit more on top. Sure thing. Yeah, your bottom lip is very plump already, so I can understand why you don't want to really add too much in there. Okay. Okay, so before I start the procedure, I just have a few questions to ask you, if that's okay. Perfect. So, the first question is, what is your date of birth? I know you've already filled out this information, but just to confirm. Yeah? 1997, okay. Are you taking any medications at the moment? Okay. Yep, just birth control, yeah, no worries. Anything else? Okay. No, there's no need to stress. Neither of these are going to affect your treatment today. Alright, so have you had any other cosmetic procedure before? Botox, for example? No, nothing? First time. Okay. Perfect. Are you pregnant by any chance? No? Okay, very good. Do you have any allergies? Just to peanuts, okay. Yeah, no worries. And any allergies to medications that I need to be aware of? No? Okay, perfect. So, the next thing is for me to explain any risks associated with the filler before we go ahead with the procedure. So, lip filler is it's a pretty popular procedure these days. There's very little risk associated with it. the main thing is this is very rare, so don't worry. So what can occur is a vascular occlusion, and this is if we get filler into one of the main veins on your face. This can lead to blindness if it's not corrected immediately. So I have been doing lip filler for years, and I've never had this happen. It's very rare, and we are trained to notice before it causes the blindness. What happens in this situation is we have to dissolve the filler immediately. So yeah, but again, like I said, this is extremely rare. We spend a lot of time studying, the inside of your face, where all the muscles and all your veins are, so it's very rare, especially at our clinic. We've never had this occur. Okay? Let's see. So, I am going to be using a filler called hyaluronic acid today. This filler is a very natural looking filler. Hyaluronic acid is a substance that our bodies produce naturally. So that does mean that your body will dissolve the filler eventually. This isn't something that's meant to last forever. This filler in particular should last between 4 to 6 months. You'll just notice your lips slowly returning to their original size. It will depend on, how fast your metabolism is. That has a huge impact on how long your filler lasts. Same with how much you exercise, etc. So these are just a few factors to be aware. And are you looking to go ahead with this procedure today? You are? Okay, perfect. So I just need you to sign here. I've got a pen for you. Perfect. Alright, thank you. So, I'm pretty happy to go ahead with this procedure today. It's going to feel a little bit like mosquito bites. I will put some anesthetic on your lips, so don't worry. We'll do that now. The first, before I apply the anesthetic, I'm just going to wipe your lips and the area around your lips. We just want to make sure that there's no dirt, no makeup residue or anything, because we will, even though it's like little injection pricks, they are open wounds and we don't want to risk infection. So let me just clean that for you. Okay. Okay, perfect. Alright, looking nice and clean. Next, I'm going to apply an anesthetic, in the same area I just wiped, just on and around your lips. This will take a few minutes to come into effect, so it'll make the procedure pretty painless for you. Okay. So just keep your lips closed for me. And I'm just going to apply all around. Okay. Perfect, perfect, perfect. Just be careful, not to get too much in your mouth. It can cause your tongue to get really numb, as if you were at the dentist. So let's try to keep your mouth closed. Are you starting to feel the effects? Starting to feel numb. Perfect. 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 Alright, so how are you feeling? Pretty numb? Okay. I think we can go ahead and get started. Let me just wipe off the anesthetic cream. Perfect. So I've got this little peach stress ball here, and it's really good to squish. So if you're having any anxiety relating to the needle or anything, you can give this a squish. Okay, so let me just put that in your hands for you. There you go. And of course, feel free to close your eyes as well. If you would like, I can kind of show you throughout and you can give feedback, or if you prefer, you can just keep your eyes closed and wait till the end. What's your preference? You'd like to keep your eyes closed? Of course, no worries at all. I completely understand. You're not a big fan of needles. Well, don't worry, I promise this won't hurt a lot. So you can close your eyes. Close your eyes. Okay. And I'm just going to go in, and it'll be a few pricks. So, 1, 2, 3, duke. 1, 2, 3. Okay. And again. Okay. I'm gonna focus on your top lip. And over here. Okay. Just the tiniest bit on the bottom. And it's just a little bit more left here at the top. And a little bit more over here. Okay. Alright. Just let me wipe a little bit. You didn't have any alcohol prior to the procedure, like in the last couple of days? No? Okay. Just you're bleeding a little bit, but it's okay, it's okay. That is very normal. Sometimes you can bleed a bit more if you have alcohol. Alright, just 2 more little pricks. And on this side. Giving your Cupid's bow a really nice shape. Let me just wipe that for you. Alright, perfect. Do you want to have a look in the mirror and tell me what you think? You love it? Amazing. I'm so happy to hear that. They look beautiful. Will you smile for me? Absolutely gorgeous. Alright, so before we do the payment, I just need to take you through some of the aftercare instructions. So, the first thing is please know that your lips are going to look different in 2 weeks' time. Swelling does last that long, so please don't worry if you wake up tomorrow and you're like, oh my goodness, they're huge. Don't worry at all, okay? They will go down in 2 weeks and it'll look very, very natural. Day 2 is usually the day with the most swelling, so yeah. So again, bruising can occur. That is very normal. Don't stress too much about it. You don't look like you're a big bruiser. If you want, there's a few things I can recommend to help with the bruising and swelling. For example, you can take some antihistamines that can help the swelling go down. And today as well, when you get home, you can apply ice every 10 minutes on and off, and this will also help with the swelling. Tomorrow will be the worst of the swelling, and it'll just slowly go down from there. Please, no exercising for 48 hours. And don't press on them or massage them. I wouldn't do so for the first 2 weeks. Kisses you can give in like 2 days if you'd like. No makeup for 24 hours. This is because, again, it's an open wound and we just don't want to get your lips infected, okay? You can do your skincare as per usual tonight, but don't apply anything immediately. Okay, so do you have any questions for me? No? You're all good? Alright, perfect. So, we can go to the front and do the payment and book in your appointment for 2 weeks' time. We just like to check to make sure everything's settled okay, and if you have any issues, of course, we can fix them for you during that appointment. However, if you have any concerns or you think there's something wrong, please don't hesitate to contact me. Feel free to call me. My phone is available 24 hours to my patients, so I will take care of you. No worries there. Alright? Well, I'll see you out the front then. Thank you so much for coming in today. It was such a pleasure to meet you. Thank you.